Canada says we have a doctor shortage.
Nearly 2.5 million Canadians do not have a family doctor. According to Ontario Medical Association, that number will continue to rise through 2026.
We're expecting that to go up to 4.4 million.
So what's it doing about it? In my last video, I spoke about how Canada looks to the world for doctors because it doesn't have the capacity to meet the demands on its own.
Addressing our physician workforce shortage by bringing in international doctors can help solve some of those challenges. Right? If you look at how our healthcare system works, we need a family doctor for everybody, and that's what we're working on in Ontario. Right now, nearly one in four people can't find a family doctor.
There are even pathways to bring thousands of physicians as permanent residents. But here's the part that no one talks about. There are already thousands of internationally trained doctors in Canada.
We have 19,000 Canadian doctors and 34,000 Canadian nurses banned from working in our hospitals simply because they were trained in another country, including advanced countries. In Canada today, we have a doctor shortage of about 40,000. In other words, if we had all the doctors that are here today in Canada but trained abroad working in our healthcare system, we could reduce our doctor shortage by half. Meanwhile, 6 million Canadians are without a doctor. We're ranked 26th in the OECD for doctors per 1,000 patients, despite the fact that we spend among the highest budgets on our healthcare system. It doesn't make sense.
So we end up in a strange situation. More doctors per capita, and still there is a shortage. Instead of significantly expanding residency training positions to integrate these doctors into the system, we're seeing growth in roles like clinical assistant positions, associate physicians, and similar supervised positions. These roles can support the system, but they are not substitute for fully licensed physicians. And many of these positions are structured not to lead to full licensure despite the physician's demonstrated competence. Many of these roles involve highly trained physicians working in positions that are paid much less and have limited autonomy compared to the fully licensed doctors. If the number of these roles grow faster than the number of residency positions, then over time, you don't solve the shortage, you just redistribute it. For the public, this means wait times don't significantly improve, access don't fundamentally change because the number of fully licensed doctors are still going to be limited. This is not about individual doctors. It's not about capabilities. It's about how the system is structured, who gets trained, who gets licensed, and how quickly that happens. Canada doesn't just need doctors. It needs to let them practice.